Hello and welcome. Good evening. This is Prescription for Life here on Nationwide 90 FM. We're brought to you by Suretime Medical. And yeah, it's always a good day to be alive. My name is George Davis, and I'm working alongside the man in neon colors tonight. If you lose him in a crowd in the dark, you will find him, which means you wouldn't have lost him because him can't last in a shirt. Good evening, Dr. Andre McDonald.
Good evening, George, and good evening to all the listeners of Nationwide 90 FM.
Yes, sir. All right. Last week we started a topic that a significant one, and I'm sure the women, especially among our listenership group, would have been rather keen on what you had to say about coronary artery disease. And I can imagine that many people would have been left questioning some things they may have been feeling, cross referencing those things they may have been feeling with things you said about the condition, and would have run to see their physician. That's what I imagine would have happened from the program last week. We're continuing the topic today because there was so much ground to cover, and we stopped at symptoms, and we have to pick up from symptoms until we have run the course with the discussion. So, Doc, that's what we're going to do this evening, and I'm sure there is a real story for you to relate about the issue that can kickstart the program this evening.
Definitely, George. And you said it right. A number of my colleagues, I will tell you, one of my lecturers, former lecturers at UA, would have listened to the program last week. I hope he's still listening tonight. But, when one of your lecturers say to you, boy, Mark, me learned some things last week, it makes you feel good.
Yes, sir.
And a number of my colleagues would have said what you just said. They would have seen females come in to them because they would have listened to the program. And so I want to take the time out to thank so many of them for listening and continuing to talk about and support this program. George, a woman came to our medical center this week. And the woman came because she had symptoms of peptic ulcer disease. Now, you have to understand that peptic ulcer disease is what many persons will call acid reflux disease,
yes,
or ulcer stomach. You always correct me.
I say ulcer stomach.
Yes, stomach. But I tell you, George, she has a history of peptic ulcer disease. And because she has a history, the fact that she presented with nausea, feelings of indigestion and headache would have made her believe that it was the same thing.
Yes.
And she said she had it, and it's customary for my doctors and myself to discuss the cases. And of course, my doctor came to me and said, boy, the lady have a history of peptic ulcer disease. We're going to do a test that we would have described here many times called a H. pylori test.
Yes.
Because the H. pylori is that bacteria that is responsible for 60% of peptic ulcer disease. So I said, yeah, doc, that's fine. But, even my own index of suspicion because of the program last week was up, George.
Yes.
And I said, you know what you're going to do? Add to that H. pylori test some other tests. And we spoke about her ECG, and we spoke about her cardiac enzyme, the test we call troponin. Anyway, when the doctor told the lady about it, the lady said, look here, she knows what she has.
Mm-hmm.
She's on an antacid.
Mm-hmm.
And she has had this for a long time, so there's nothing wrong with her heart. So please, don't bother to introduce that test to her. True story, George, just happened. The lady said she will not do it. But what was significant is that her antacid was no longer working.
Mm.
And it is so important to understand that we told the lady that, look here, you see, with this, we're going to have to, it's better we refer you to a hospital. Many Jamaicans are afraid of the hospital.
Yes.
So she said she agreed to do the cardiac enzyme, and she agreed to do the ECG. She said that's minimum. She's not doing anything else. ECG, and she even made a big thing about the cardiac enzymes. She did the ECG, and lo and behold, she had significant ST elevations. We spoke about that
In
last
detail
week.
last
In
week.
detail.
Yes.
When we get to the investigations part of
You
this,
refresh the memories of
we'll
the
refresh
listeners,
the
yes.
memories of our listeners. But I will tell you, George, she had significant ST elevations, so much so that we had to refer immediately.
What was the age of that
The
patient?
age of this lady, believe it or not, she was in her 40s. So she was quite young, because in the literature, we describe young women as women who are less than 55 years when
Yes.
it comes to heart disease.
Yes.
So she's in the category of young women. And we said, look, we have to now refer you immediately. So it was a probably referral before we did this, and now we are saying it is time for you to go. She agreed to do her cardiac enzyme. It wasn't positive, but I'm going to say yet.
Yes.
Remember, we said last week that normally this is repeated within 4 to 6 hours, because it takes up to 4 hours
Yes.
for it to increase. This troponin one that we're talking about, and therefore there's something called atypical, not typical, because A means not. Atypical symptoms is what we find in women, and here the issue. Women in generally, George, has delayed diagnosis when it comes to heart disease. Because the diagnosis is delayed, they have under treatment challenges. In other words, many of them are undertreated. Because they're undertreated, their outcomes are worse. As a matter of fact, here one very important study shows us that 56%, or you could just say 1 in 2 women, do not recognize heart disease or heart attack as the number 1 killer of women. So much so that when they have anything to do with their chest, they do not even go to the doctor.
Yes.
They do not even attend doctor. 1 in every 9 women between 45 and 64, 1 in every woman between 45 and 64 will experience some amount of chest symptoms. Listen to this. By the time they get to 65 is 1 in 3. 1 in every 5 women will die of heart disease. And 1 in every 5 women will have a symptomless, a silent heart attack. In other words, when it happens, if the woman is sitting around her desk doing her work, she would not have known. She continues. You see why the diagnosis is delayed, hence treatment is delayed,
Yes.
hence outcomes are worse.
Yes.
Because it's more silent. One of the things people are going to ask why, George, and I will tell you that there are so many reasons, multifactorial. We realize that there are social reasons in terms of women's affordability, how care is offered to women in many places, women themselves not knowing that heart attack is significant and not going to the doctor because of chest pain. Doctors missing the diagnosis because in women less than 55-year-olds who present to the doctors with chest pain, they're less likely to do cardiac tests. We spoke about that last week. But listen to this. We have found out that the arteries that are affected by blockages in men are slightly different from that in women.
Yes.
Women tend to have the more tortuous, smaller arteries that become blocked over time.
Yeah, more constricted, eh?
That's right.
Right.
And men tend to have the bigger arteries, right? On certain significant parts of the heart, like the left side of the heart, that is affected.
And though you're not saying it, I mean, from what you've explained just now, that could explain the difference in athletic capacity and performance between men and women. Bigger arteries or vessels around the heart pumping more blood. That's why the man is able to be faster, stronger because of this thing.
There are so many things, George,
Yes.
and you know you have hit that there are so many programs that will be coming very soon on sports medicine and athleticism,
All right.
because that is my major area.
Yeah.
But I want to say this last thing, George. I want to say that because of the way how it presents in a female, the first symptom in 1 in 5 women of a heart attack is nothing at all. And then we are picking up from
The first symptom is nothing at all.
nothing at all.
What?
Nothing.
Then what chance do women have, Doc?
Well, 1 in 5, George,
Wow.
20% of women will have a heart attack and not feel anything. So they'll be sitting at their desk, they feel nothing, and then the next time they know is when they collapse. Or I said this last week, which is significant. Here, our women are different from men. In their sleep or
Yes.
when they are at rest,
Yes.
as opposed to when they are physically active. So a man is more likely to get a heart attack when he's running, jumping,
Yes.
during sexual intercourse. You
Yes.
spoke about that.
Yes.
A woman is more likely to get it when she's laying down in her bed,
Yes.
when she's sleeping, when she's at rest. That is what brings it on a woman. This is a scary thing, because guess what happens? She can miss it during the day, and when she's asleep at night, that is when it happens. And guess what, George? This is when everybody else is asleep.
Yes.
So by the time it is recognized to get her to the doctor or to call the ambulance or to do things like that, here is where a big challenge is. Which is why when we get to the investigation parts of this tonight,
Yes.
we are going to say, women, you need to do 1, 2, 3, 4 things to help to prevent this.
All right. For those of you who know your old comedies very well, as we come up to the first break on the program, you'll know very well Fred Sanford and Son, always talking about he's having a coronary, and Elizabeth, hold on, I'm coming, because his wife, Elizabeth, who died and left him, and he always fakes having a heart attack when he is finding himself in a bit of bother. I see my producer, Mrs. Lawrence, doing it over there. Yeah, as long as it's simulation, you have so much to live for, ma'am. You'll be with us for a while, I'm certain. All right, we take our first break on the program this evening. We're talking about coronary artery disease. It is a very important topic, as are all the topics we discuss here on Prescription for Life. We're brought to you by Suretime Medical. They're at 10 Trafalgar Road in New Kingston, 3945433. That's their 24-hour lifeline. Make that call if you find yourself in a spot of bother. Welcome back to Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of the good folks at Suretime Medical. You can find them 10 Trafalgar Road in New Kingston. You can call them anytime. They're 24-hour lifeline, night or day, holiday or regular day, 3945433, and there's a landline, 906-7873. Short time, general visit. Yeah, they facilitate that. They have a 24-hour medical facility that can facilitate overnight admission. They also do house calls, and they're running a special, they have a Super 7 suite of tests, inclusive of the critical ECG test for those who feel that there's something assailing their heart, and it's not love, it's not Cupid playing a number on their heart, it's something damaging. Well, you can get an ECG test in that Super 7 suite of tests, and the whole suite, the whole Super 7 costs only $3,500. So yeah, make an appointment to go down to Showtime. You don't even have to make an appointment. Just walk in, and they'll be more than happy to assist you. All right, Doc, we're talking about coronary artery disease, and we left it at symptoms last week. May it please you to pick up from that point.
Let me tell you. So even though women will expect the sort of men-like symptoms, which is left-sided chest pain, this is what is expected. The pressure, the squeezing, the fullness, or somebody sitting on the chest. What is significant, George, is that we said before that many of the times the pain in the chest, especially in young women, are not diagnosed because, unfortunately, the index of suspicion in terms of healthcare providers making the connect is not where it should be. The thing is that women without chest pain now is a very common thing, much more than men, 43 to 30%, and so dizziness, lightheadedness, jaw pain, neck pain. And we want to take time to ask the women of Jamaica to listen to these symptoms. Because, George, if you have jaw pain, the last thing you're going to think of is a heart attack. You're going to think that, hey, something is happening in my mouth, right? Shoulder pain, George, back pain. People think that a heart attack is always on the left side. If I'm saying that you can have pain in your right arm,
Yes.
and still be having a heart attack, here is something that is significant for persons to think. So one or both arms is something to look at. Shortness of breath, this indigestion, nausea, not feeling well is a very, very common one, and it is associated with vomiting and heartburn sometimes. But many women, George, will tell you that they have these symptoms of feeling tired, overly tired. They just feel this fatigue. It's something we see all the time. And then my patient who presented to me, we spoke to her. She was our entrance last week, who had the shortness of breath and the swelling of the ankles and the legs, and some of the times even abdominal pain. Is something that you have to look out for. One study showed that up to 70% of women in one study did not present, even though they were diagnosed with heart attack, they did not present with chest pain. Now, younger women are twice as likely to present without chest pain than older women. We said it, 41% to 24% in that study. And it is critical to understand that because of all of this, women are twice as likely to not be referred by men, and are more than twice as likely to have the diagnosis missed. There is something significant now that I want the women to know. There are a number of women, as a matter of fact, 2 in every 3 women in Jamaica, Georgia, are overweight. There is this acceptance that a big-bodied woman or a woman with a large waist circumference is an acceptable, fashionable statement. When your waist circumference, that is putting the tape measure at your navel, George,
Yes.
and bringing it right around, measuring it, is 36 size greater than 35.
Yes.
You're twice as likely to have chronic illnesses like hypertension and diabetes. Very important. And there is something called metabolic syndrome, where a woman with that waist circumference greater than 35, with high cholesterol, high blood pressure, and high blood sugar, those 4 things put her at a very high risk for diabetes and heart disease. We have realized that young women now are presenting with significantly higher heart disease incidences because of this metabolic syndrome.
Yes.
So they're thinking now that overweight, the study we looked at says fat and fashion, as its heading. They're thinking that overweight or being fat is something that is fashionable.
Yes.
I would say that metabolic syndrome is now affecting young women in significant proportions, and you have to watch for that. I'm saying to the young women, it is not as fashionable as you speak.
Yes.
With these symptoms, George, I quickly want to say, when a woman walks into a doctor's office, like my office or any one of my colleagues, and you look at that woman, you can see just by looking whether or not she appears to be overweight or whether that waist circumference is high. And when you do our vitals, many times our blood pressure is high. And I want to say to the woman that obesity, high blood pressure, when we search later, we may even find high cholesterol.
Yes.
Are significant factors for heart disease.
There's a question that came through on the WhatsApp. This came from a listener who said that her mother died from a heart attack, but there were no symptoms, classic or otherwise, except that her mother complained of gasping for air, and she wanted to know if that is a primary symptom of the condition.
We did say, we said shortness of breath.
Oh, so there you go. Shortness of
Difficulty,
gasping
yes,
for air, yeah.
yes, difficulty breathing, and that is, and you see, those are the symptoms I want the woman to be looking out for tonight. Check yourself, see when you have it. It's so significant.
But doc, if as you say, and let me position the question differently, because it's not an if. You are the expert. You are learned in this field, and you've done it based on the research. If it is that pain in one or both arms, as you've said, lightheadedness, as you've said, dizziness, heartburn, fatigue, constant fatigue, nausea, vomiting, shortness of breath slash gasping for air, pain or discomfort in the neck, in the jaw, if all of these things are symptoms, doc, then it is that the average woman in the categories that you've defined who are particularly vulnerable to coronary artery disease, if they go to a doctor, these are among the laundry list. These are on the laundry list of symptoms that they could be experiencing. So it is very difficult for a medical professional to say, you may be on the road to having a coronary, as Fred Sanford would say, because the symptoms are so common and they are so much associated with several other conditions. So how does a medical professional wade through the minefield, doc, and say, okay, we're going to put you on this, we're going to try this course of treatment, we're going to try to change this where your lifestyle is concerned, because you may be on the path to a coronary because of the symptoms you've explained?
Well, since last week, 5 of my colleagues would have said to me, but I may tell you, it's hard for if a woman come in with neck pain, you not think it's torticollis, which crick neck,
yes,
we call it, or it's hard. I mean, it's really hard. The index of suspicion has to be very high.
Yes.
And we were having a conversation, and we were talking about looking at the lady's family history, looking at her personal history, looking at her risk factors, which we spoke about last week, whether or not she has all of these family or personal history of high blood pressure, diabetes, obesity, high cholesterol, whether or not she smokes, her husband smokes. Because remember, secondhand smoke.
Yes, you said that last week.
Her father smokes. Did she grow up around smoking as a little girl? Because remember, coronary artery disease starts from you are a child, and therefore you have to look at these risk factors. And remember, when a woman sits before a doctor, this takes time. It's a whole heap of question, Yes. I remember you have a waiting area out there with patients knocking down your door.
The person not in the room wants the process to hurry up so that they can go in the room
and stay long.
But that's how it goes.
That is my number one thing I can tell you, because no patients want to leave. As a matter of fact, I think you have put me in even a worse position, George, because people will come with laundry list.
Yes.
And they write. A lady came to me the other day, George, boy, I won't call her name. She's such a good friend of mine, such a good patient. She when she comes, she makes me laugh because she has a book, George.
Yes.
She went and bought a book, George. And she writes in that book, and she said, Doc, all I have is just 3 pages of stuff to ask you about today. And she starts to ask, because I think she believes she's coming to school.
There you go.
But a lot of patients are like that.
Yeah, just before we go to the break, though, you had said in the first segment that 1 in 5 women will die.
1 in 5 women will die of heart disease.
But here's the thing.
That's a global figure.
Yeah, man.
No doubt about that.
No doubting your figure. I wanted to clarify, though, because last week you spoke of the particular and the specific vulnerability of black women to the condition. So when you said the 1 in 5 women will die, I was saying, is that 1 in 5 of all women, or is it, yes, that it's all women, but that black women, then the incidence would be higher for them?
We can just tell you the figure. It's 47 versus 36% black to white. So blacks are more likely to die. So if you look at the 1 in 5, more black women are in that 1 in 5. So let us multiply that by a factor of 3.
Yes.
You would 1 in 5 is going to give you 3 in 15.
Yes.
Yeah. Just understand that 47 to 30 is about 1.5. A black woman is 1.5 more times likely.
Yes.
So it's 1.5 to 1, which is going to make it 3 to 2.
Yes.
So what we're saying, for every 3 black women that dies, 2 white women die.
Yeah.
So black women are more likely. As a matter of fact, I can give you it in this order. It's black, then it is Asians,
Yes.
then it is Hispanics. White are last.
Excellent. Excellent stuff. We take a break. Back with more on Prescription for Life after these. Back with us on Prescription for Life, brought to you by Suretime Medical. Suretime Medical, you can find them at 10 Trafalgar Road in New Kingston. And their 24-hour lifeline is 394-5433. It's a very important number for you to have. You know, increasingly big events, entertainment events, people realizing how crucial it is to have ambulance support in the event of a mishap. So if you are at an event and there's no ambulance coverage and something happens, an emergency, who better to call than Short-Term Emergency Medical? 394-5433. An ambulance will be dispatched post haste, and anywhere you are across the island, they can facilitate the provision of an ambulance for that particular emergency. You can also call them at 906-7873, 906-7873, and you can drop in anytime on their office, 10 Trafalgar Road, New Kingston, and ask for their Super 7 suite of services for only $3,500, only $3,500 in that test is an ECG test. Now, Doc, we were talking symptoms before the break, and we were looking at the last thing about the numbers in terms of the demographic groups of women, especially who are most vulnerable to dying from coronary artery disease. And you said that, yeah, it's the black women who are the most at risk.
They are. And before we go into investigations, which is going to be so important,
Yes,
George, this is because the burden of chronic illnesses, hypertension and diabetes, is present in 59%, almost 2 out of 3 black women. So the highest burden. So black women have high cholesterol, diabetes, and hypertension more than all other ethnic groups. And that's the reason why. Remember, those are, in addition to smoking, the biggest risk factors. So my Jamaican black women listening to me, the people who are listening worldwide, you have to remember that you have Botswana, you have South Africa, you
Yes.
have Nigeria, all my friends from there who continue to WhatsApp and continue to listen. Just understand that, just decrease the burden of these risk factors, and we will put ourselves in a better position. George, investigation is very important, because when that lady came, the lady who we opened with and said that she had headaches, nausea, remember she had a history of peptic ulcer disease.
Yes.
I have here in front of me, as my doctor wrote, that she was also overweight. That was a part of her history, and she noted that the antacid that she normally takes, the tablets, would have not been helping. She decided that she was going to do some investigations. This is why you want to do investigations. Here's the big point, George. A study was done, and the conclusion of that study, this is a big study that is, in a big up-to-date journal that we look at as doctors. The conclusion of this study, that females, very important that they listen, females show changes in what we call their inflammatory and blood indices, right? 1 year before their index presentation. Let me say this in another way.
Yes.
Females show changes in blood and certain bodily characteristics 1 year before they're going to present. That is how good God is to females.
Yes.
He has allowed for them to have a sort of thermometer, a sort of point yardstick, something that will point to the fact that in 1 year's time you might get a heart attack. So you need to jump on it whenever you see these things. So it is so important for females to do some things, especially females who are at risk. We said before that if you have brother and father who had any sort of heart disease before 55, or mother and sister before 65, then you have a bigger increased risk. That's the first thing you need to look into. Look into your family history.
Yes.
Look, when you see that, you have to ensure that, especially by the time you get to 40, even though it presents much earlier. But a lot of the studies now, as when you asked me about the 20-year-olds last week, there are so many studies that look at heart disease 20 and above. But the big investigations, we were looking at persons between 35 and 64, for
Yes.
example. And what we realize is that they start presenting a lot of women around that time. So we are saying every year when you take your checkup, especially if you have family members who have a history of chronic illnesses or heart disease itself, then look at certain significant profiles. You must look at your HbA1c. We spoke about that so many times on this program. It tells you if it's greater than 5.7, George, as a matter of fact, 5.7 and greater puts you in a pre-diabetic. Greater than 6.3 puts you in a diabetic state. It's so important that you look at your HbA1c. You have to look at your cholesterol profile. Bad cholesterol, if it is higher, George, you're at increased risk. Good cholesterol, if it is low, because remember it has a protective purpose, you're at increased risk. Triglycerides, which are fats, if it is high, you're at an increased risk. These are very important things to look at. So when the doctor says he's going to do your HbA1c and your lipid profile, do not do it. It's a very important thing to look at. You have to be monitoring your blood pressure. We're looking at the big risk factors. We're looking at high blood pressure, high cholesterol, and diabetes. The doctor is going to want to do your complete blood count, your kidney and liver function tests. Very, very, very important. Absolutely important that these are looked at. But it is so important that you understand that every single year, George, you must go visit your doctor, especially, George, if you have risk factors, 30 years old. If you have no risk factors, 40 years old. If you have any symptom at all, remember we went through the long list of symptoms, especially the atypical ones, then you go immediately. Do not take a chance with neck pain, arm pain, back pain, and just say it is. It's better you do the test, George.
Yeah.
It is better they come back as normal.
Yeah.
And you continue. And ECG is a critical test. When it comes to ECG, George, a lot of ECGs can come back saying nothing, or can come back with insignificant findings. But it's also a very important test to do, because many times the ECG comes back in such an abnormal way that the cardiologists on board, the specialists now have to take it, look at it, assess it, and we allow them to decide whether they will move on.
Yes.
You're going to say something, George, but just before you say something, I just want to say this. The ECG, George, becomes important because, especially when you have some form of symptom, whether it's atypical, meaning not the big chest pain,
Yes,
or whether it is the typical chest pain, it becomes critical, because we look at the waves in the ECGs that we call the PQRST waves, right? We just use some letters in the alphabet to name them.
yes,
And we look at the lines that are supposed to represent certain distances and certain heights in a normal person. You see the line that goes from S to T? If that line is elevated above where it is it normally supposed to be, when we look at that heart test, we call it ST elevation.
Yes.
And an ST elevation myocardial infarction is called a STEMI. ST, E for elevation, M for myocardial, I for infarction. That is why we call it a STEMI. If you are having chest symptoms and you're possibly still having a heart attack, even though it is not elevated, we call it a non-STEMI.
Yeah.
Why is it important? STEMI ones kills more than non-STEMI. STEMI ones are worse. They are severe. It involves the entire blockage of the artery. The heart muscle behind the STEMIs die. This is what causes the big increase in the troponin, the cardiac enzymes, and others that we may do. The non-STEMIs occur more commonly. They are not as deadly, but they still can have a poor outcome if the diagnosis is delayed.
Yeah. I wanted to ask, where the ECG is concerned, if someone does an ECG because they're feeling bad and they go to the doctor, they're feeling badly enough to go to the doctor, and they do this ECG, and the ECG comes back, the expert says, well, this ECG looks normal. The bad feelings persist. Yeah? And you say, all right, in 2 months' time, you go for another ECG. Is it common for an ECG taken at one point, and then an ECG is like a survey? It's a moment in time that the survey captures. So the ECG done in January, normal, but you go back in March and the ECG is now abnormal to the extent where the doctor says, no man, there's something seriously amiss here. Is it normal for that to happen in the gap of 2 months, a month, for ECGs to show wildly different results in a person?
So a study was done on the question you just asked, which is what makes it such a very important question, because many medical professionals, doctors, professors have asked that same question. 21.4% of ECGs with persons with frank heart attacks have come back normal.
Normal, oh my. I wish you wouldn't say that.
and so this is why those atypical symptoms,
Yes.
the high index of suspicion. If somebody is having chest pains and that ECG comes back within normal limit, you're absolutely right. The ECG is like a picture. It's like a picture. And because we're on investigations, when that ECG comes back normal, so we take a picture of Bugs, and when Bugs put that picture up on his DP, or he puts it up on Facebook or
On his Instagram.
Yeah, there
man.
you go. You see Bugs, you see him well dressed,
Yeah, man.
and you say, that is the man.
Yes.
That is the man. You would not have seen Bugs when he wakes up in the morning.
Right.
You would not have seen him when he was getting dressed.
Yes.
You would not have seen him at times when his shoes is not so well decorated.
Yes.
You would just see one picture in time.
Yes.
And that's exactly what an ECG is. It's 10 milliseconds of movement. You see how short it is?
Yes.
And therefore your question is perfect, George. Can it miss something during that 10 milliseconds?
Yes.
But most.
And the data says resoundingly so, it can miss.
Yes.
There you go. And then I'm going to the break. You know, the reason to ask you the question as well, because people say, oh, the first doctor never do the ECG good, because see this doctor now run the test and the test come back and we could have dead, and people don't realize you blame the medic and it's not the medic's fault. We take the break. We take the break now. We come back and we're going to enter the home stretch of Prescription for Life on this Tuesday evening. Back with us on Prescription for Life here on Nationwide 90 FM. Remember the Super 7 suite of tests available at Suretime Medical for only $3,500. Yep. A suite of 7 individual tests, including an ECG, and that whole package costs only $3,500. Remember, Short Time Medical, they facilitate house calls. They run an ambulance service that provides an ambulance anywhere you are around the island. If you're having a sporting event or an entertainment event or a family gathering, if your family big, or as Jamaicans would say, if your family big, yeah, and you're having an event, Short Time is the place to call for an ambulance to be on standby in the event that something unpleasant happens. They are the people that you want to have on speed dial in the event of a crisis. And you can key in their number 3945433 or 9067873. Those are your emergency contacts. If you have, if sometimes in organizations people say, okay, can you list your emergency contact? You should list your emergency contact at Suretime Medical. All right, there you go. All right, we're continuing with this topic, coronary artery disease, and Doc has spoken a lot. It has taken us 2 programs to get to this point. There's one question I want to ask before you pick up, Doc, and it is this. I can well imagine more than a few listeners having taken in what we would have said over the last program and 3/4 and said to themselves, well, you know what? This thing is a killer of women. It's a killer of black women. And as a black man, I have nothing to worry about. What would you say to them, Doc, if that's what they take away from the 2 programs that we will complete on coronary artery disease?
It is the number 1 killer of black men also. It's as simple as that. It is not gunshots, George.
Yes.
It is not gunshots. As a matter of fact, starting did a study. You're 13.
Oh, I understand there's an issue with Doc's microphone. We're going to give him some time to get that sorted. So, yeah, the question I posed to Doc, the black men who will have heard us over the 2 programs and have they're breathing a sigh of relief to say, well, you know, I only have to worry about my lady or the females in my life, especially the ones over the age of 50 or 45, because based on what Doc said, they are the ones who are most vulnerable to coronary artery disease. I think his microphone is back. You would say what to the man who has that takeaway from the 2 shows, Doc?
It's the number 1 killer of men, to George, and I will even say that it is not the gunshot, it's not the motor vehicle accidents, it's the number 1 killer. Heart disease number 1 for both males and females. Quickly starting did a study that one is 11 to 13 times more likely in Jamaica, this is Statistical Institute of Jamaica, to die of a chronic disease like heart disease than a gunshot. Let us make that clear.
Yes.
13 times more likely. You did say the ECG was a picture. And this is why when I refer to cardiology, many of my patients, there is a video. Now, when you see bugs on the video, it is more than a picture.
Yes.
Because you see a little bit more of bugs. And a video of the heart is what we call an echocardiogram. And that echocardiogram shows you a little bit more than an ECG will. It shows you how blood flows through the heart. It shows you the motion and the movement of the walls of the heart. So it can show you heart movement that has been damaged over the years, whether or not it's good movement and bad movement. It shows you the valves of the heart. It measures a lot of parameters of the heart, and it can look to see whether they are outside normal. So many, especially what we call your systolic function. Remember the patient that I opened with last week, we saw her EF, or ejection systolic function, or ejection fraction. When we measured that, remember it was less than 35%. Remember that patient?
Sir. Yeah, man.
And we measured that immediately on echocardiogram. Just after I saw her, the cardiologist and myself, we did that on her immediately. And that is what we found. So it's very important. She would have gone on to the further investigations, because some of the times when we do that, because of her ejection issues, we wouldn't have subjected her to a stress test.
Yes.
But many of my athletes, and I'm going to talk a lot about athletics to come in the future, George. But many of my athletes, when they come to me, George, and I find that their ECGs are abnormal, before I put them back on the field, I subject them to a stress test. That is, they not only have now this ECG or this echo done, but they have it done while they are exercising.
Yes.
And it shows me whether or not the heart can manage that form of exercise. It even goes further, because some of the times now I want to see where the blockages are. And this time we can do something called an angiogram, a coronary angiogram, which is where we inject something very special into the blood and it outlines the arteries of the heart, and we take special pictures and we can see where is blocked or where is narrowed. This can be done using MR, magnetic. People would have heard about MRI before. Is what we can do it using the same sort of technology, and we can use CT. People would have heard about CT scan.
Yes.
So there's a couple of things that can be done to look at the heart and look at the heart in detail to ensure that you're not missing anything. So women must know that these things are possible. And they must understand that when these things are done as doctors, we can treat better. Just understand that I am begging the women, George, to quit smoking. Please get away from secondhand smoke. The men who are listening, George, they need to stop smoking around their women. It's as simple as that.
Yes.
It's as simple as that. They must have a healthy diet. We're talking about whole grains, fruits, vegetables, decrease fats, decrease saturated fats, decrease trans fat, decrease sugar, George. Very, very, very important, and decrease salt, right? Exercise is very, very important. You must talk to your doctor before you exercise. I don't allow my patients who have very, very high blood pressures, systolics greater than 160, that is the top number, the bottom one greater than 100, to be running up and down. We try to control the blood pressures. There are persons who have had heart attacks before, and it's very, very important that they consult their doctor before they run an exercise, because some are allowed and some are not. But exercise is a very important part of rehabilitation for even persons who have had heart attacks before. Atypical risk factors like anxiety, stress, depression, especially in women, must be managed. And women tend to again have that more than men. Avoid alcohol. My patients who are listening to me right now, great friends of mine, would understand the challenges with hypertension in pregnancy. So that is something that also needs to be managed significantly. Remember, George, a woman must drink 1 drink of alcohol per day. Please understand that 1 drink. George, it doesn't mean that if you don't drink Monday, Tuesday, Wednesday, Thursday, Friday,
You can drink 6 drinks.
you can
on
drink
Sunday
6 drinks.
to make up,
Exactly,
yeah?
to make up. It doesn't work. And remember, we have calculated what a drink is on this program. We're going to have a very special program on alcohol, because we realize it is being used more and more. But suffice it to say, if you put 1,000 on your calculator, George, 1,000, 1 and 3 zeros.
Yes.
And you will look at the bottle of alcohol, and you will look at the concentration, whether it is 60%, 42%, 12.5%, or 3.75%. And those were deliberate numbers, right?
Yes.
You take that 1,000 and divide it by that 60, that 42, that 12.5, or that 3.75. You will get the amount in milliliters. And 1 glass is normally 250 milliliter. Yeah?
Yes.
You will get the amount in milliliters, mils, as to how much is 1 drink. That is how you calculate 1 drink. It simply means the higher the concentration, the lesser the volume.
Yes.
It's very important. I've just told you how to do that. The most important thing, George, is that if the woman has the symptoms that we spoke about, the family history that we talked about, the risk factors that we spoke about so many times, she needs to get a check from her doctor. Do not wait until it is too late.
All right. The crucial thing, one of the most crucial takeaways for me from the 2 shows, Doc, is when you said, look, don't be fooled. Issues with the heart that will lead to coronary artery disease, they start from birth. So it's very much progressive. So don't believe that in someone with a healthy heart who's not exposed to secondhand smoke, who doesn't eat too much sugar or too much salt, who exercises, who lives well, and then there's a period of 2 or 3 years of bad living that will suddenly cause a condition. No, it starts from you arrive on earth. Things are happening to your body that will eventually put you in a position where that becomes a serious issue later on, perhaps a fatal issue. That's what the medic said, not my words. Doc, I want to thank you this evening for your expert contribution as usual, and I want to thank the production team. I see the lovely Michelle Dean is back and in rude health. Our producer, or slave driving producer, Mrs. Latoya Lawrence, has just instructed me to tell the listeners that we're talking about leg cramps next week. I know everybody has leg cramps. Everybody has leg cramps, yeah? And that's the topic for discussion next week. So thanks to Mrs. Lawrence, our producer. Thanks to Michelle Dean, key support where this program is concerned. And thanks to you for listening. And the man at the control is in the fitted shirt. The man has on a bespoke shirt, Doc. Yeah, and then a regular tailor boy with them shirt, bespoke tailored shirt. Andrew Anderson, yeah, at the controls. This has been Prescription for Life, brought to you by Suretime Medical. Good evening.